From Jasmine.
Good afternoon, everyone. Thank you for joining us. Mask wearing aside, I think I see some familiar faces, so I will try to get to the question and answer portion of the event as quickly as possible. As Lori said, I'm Jasmine Boyle. I work with the Coalition to End Homelessness. I do like to always take a moment to talk about what the coalition is. We've existed here in Anchorage since 2004. Originally, we were a grassroots group of individuals who led homeless service organizations that came together to problem solve together. It does take many different folks from many different sectors coming together to end these complicated social problems. Back many years ago, the coalition became an official 501c3, and in 2017 we hired our first staff. So we no longer are a grassroots group of providers who come together. What we are now is a dual-layered organization that not only works with the provider community, with people with lived experience, but also housed members of the community interested in talking about homelessness. We work a great deal with the public sector, the private sector, and certainly with our partners in government, both at the local, state, and of course the federal level. If anyone's ever interested in getting engaged, our website is pretty easy to navigate to, and we welcome the communication. More importantly, when we begin to talk about homelessness, the question I most commonly get is, why are people experiencing homelessness? What causes homelessness? There is a copious amount of research available. The start and the end to homelessness is housing, and most often is the lack of affordable housing. I'm not a fan of reading slides, and so I'm sure this information will be available to you all. We won't go through all of this, but it's interesting that if you talk to federal partners, for example, the National Alliance to End Homelessness, they are often frustrated that we disconnect the issue of housing with homelessness. There are many faces of homelessness. Anchorage is a great example of that. There are elders experiencing homelessness. There are young people. There are families with young children. And there are certainly the people that we see outside. All of those individuals are experiencing homelessness, and the common factor with every one of those individuals is they do not have a safe and reliable home that they can afford to stay in for the long term. We can keep moving ahead. We can certainly talk about the systemic factors that make homelessness more complicated. People living with mental health challenges, youth who have been victims of child abuse and can no longer live with their parents or their families of origin, elders who are on a fixed income. All of these other societal challenges like affordable housing, again, substance misuse, mental health challenges, all of those things absolutely impact homelessness. But again, what the national and in many cases international experts will tell you, homelessness starts and ends with a home. We are all needing a home to stay safe and to keep our families safe. Moving on, I also frequently get questions about what homelessness looks like in Anchorage, and I'd like to take a moment to talk about that, but looking at the slides, the National Low-Income Housing Coalition speaks a great deal about, of course, affordable housing, and when I talk about housing, I like to remind folks we do annual reports. Certainly the Alaska Housing Finance Corporation covers this in great detail, but it's interesting and important to understand Anchorage does not have enough affordable housing. I see some of my partners in the room who have done this work with us on the housing side of things. These are some statistics that came out from the 2021 report. And what I think is particularly compelling is if you look at minimum wage in Alaska, minimum wage earners cannot afford to live in our community. And that is a very important factor in the homelessness. These are very comprehensive federal reports. Again, the information is in the slides and you can certainly look into the information. But I think it's important that we start on the same foundational understanding that housing is a critical element in solving homelessness. And that means housing that we can afford to help people stabilize in as a community and certainly at the individual level. As I mentioned, we get quite a few questions about the data. I think it's important to also hear what our partners are saying. So when we talk about people, and the federal term is extremely low income, these are people that are spending more than 50% of their monthly income on their housing. Not sure about the rest of you, but I know that if half of my paycheck is going towards housing, that leaves very little money for things like food, childcare, transportation, medical expenses. And this time, I think that's important to call out. What you'll find is interesting, and this is information from Access Alaska, this is information from AHFC, is that when we talk about who are the individuals who are extremely low income, many of them, almost half of them, are people that are income burdened. people that just don't have enough money to make the rental expenses doable with their other expenses. We're also talking about elders. We're talking about our senior community. For folks that aren't aware, Alaska has the most rapidly aging state in the nation and has for quite a number of years. Alaska Housing Finance Corporation calls it the Silver Cliff and projects that particularly in Anchorage and the Mat-Su Valley, we are rapidly aging as a population. We don't have enough affordable housing for our elders who become fixed income individuals. Additionally, if you were to talk to Access Alaska, we have 2 to 3 wait lists for people that need ADA compliant units. So if you think about our elder community or our vulnerable community, even if we have housing and even if it's affordable, it often doesn't have the basic structure to make it livable for people in wheelchairs, people with different mobility or different physical health challenges, and all of this triggers homelessness. If you have an opportunity to meet the individuals in our shelter community or to talk to the individuals on the front line of that work, we often have folks in our shelter system who require personal care attendants, folks that have been asked to leave assisted living homes. These are people that are not going to get the type of care that they need in a shelter system. These are individuals that have higher level needs. And I think it's important when we start a conversation about homelessness to talk about the fact that these are the people we are talking about too. It is not just the individuals that we may see outside on any given day. Kind of moving along, I think it's also important to mention that we're also talking about people that are leaving incarceration. I think it's important to mention in our community that the majority of people leaving jail or correctional facilities do not know where they're going to live when they're discharged. And if we can't get ahead of that, then we could end up as a community that has many people living on the streets who are formerly incarcerated and are going to have a challenge finding employment and getting stabilized. So that is also part of the complexion of the many different types of people experiencing homelessness in Anchorage. So the numbers, really what I intend to say here again is there are many different types of people experiencing homelessness in our community. This year, just based on our data system, 2020, we had almost 10,000 unique individuals come forward for services. The vast majority of those folks you will never see on the street because the system serves more people than it fails. We care for more people and get the majority of these folks into shelter, into housing, and stabilized. And quite often, we never see these folks again once they've got their feet back under them, unless they come back to work and to give back to the community of people who assisted them. Again, we have some folks in the room, and I know Lori has some quotes from people with lived experience. I suspect that you'll hear some of that. But the people on the streets are not the only people experiencing homelessness in our community. And it's important to call out that we have some tremendous successes. We have not had a family have to sleep on the streets, to our knowledge, in almost a decade. We have been able to do more good than we haven't. Moving on. You could go back one?
Sorry.
Folks like to talk about the point in time count. I'm a bit of a data geek, not as much as some of our friends on the panel, but we have a federal requirement that we go outside and we count the number of people experiencing homelessness every January in Alaska. I grew up in California. When I showed up in Alaska and it was 20 degrees outside and I was asked to walk around the woods and count people, it didn't seem like the best way to answer the community's question about how many unsheltered individuals we have. However, we still do it every year. I really share this with you today to say, while I find this to be a weak way of describing homelessness, we have seen homelessness increase since the economic impacts of COVID-19 in our community. Quite frankly, the numbers went up very significantly, even in this one night in January. We've certainly seen families in particular be very hard hit with what I call new homelessness. And I think if we all pause to reflect on that, when our childcare system faltered in the midst of the economic changes of COVID, when our schools changed their availability to provide what in many cases is childcare, in addition to education in the daytime hours, two-income, dual-income households and single caregiver households were unable to care for their children and keep their jobs. And that increases homelessness when people are not able to pay their rent. I will say, we're very grateful that some of this has been mitigated by the rental assistance. There is still going to be ongoing applications for rental assistance. So we are keeping the bulk of folks in homes, but not everybody. And I think that's important to understand. like to mention 2020 was the first year that Anchorage had comprehensive street outreach. This is a very common question that I get from the community. How many people are truly living outside? What we discovered with a full year of street outreach with our partners at Choices Rural Cap and Anchorage Health Department is we saw over 1,000 unique individuals outside. Now, the interesting thing that many of our experts on the front line will tell you is they're not all outside at the same time. Most of them accessed shelter at different periods of time, but there is a cycle. There's a cycle of people coming in and out of shelter. There were also a number of people who were new to homelessness that were on the streets, which of course is a concern because we know that street life is incredibly traumatizing and dangerous and triggers a number of other challenges for individuals. So it's a bit of a fact I like to respond to with the community because this is the number one question I ask from members who don't do this work for a living but are interested in getting engaged and solving our common challenges. When I talk about how we solve homelessness, much like the healthcare system, we need an array of services that meet everybody where they are. So as I said, there are many different reasons for homelessness. All of it relates to housing, but there's also different complicating factors. An elder in our community is likely to have different needs than a 17-year-old youth or young adult. Different set of struggles to achieve some successful transition around, and certainly a different set of resource needs. We have to have a full continuum. This certainly isn't our thinking, this is international thinking from thought partners who do the research and evaluation on these projects. And so what I like to remind folks is not everybody needs permanent supportive housing that we're going to be paying for the long term. In fact, most people, they need a hand up. They just need some temporary assistance to restabilize. And that's essentially what we're talking about building when we talk about a full continuum of services. Just like when I go to the hospital and there are different folks that are going to treat me if I have a hangnail, different folks that are going to treat me if I have cardiac symptoms. There's just a different level of need, and a full continuum allows us to be thoughtful and effective with the limited financial resources and human resources we have, and allows us to meet individual needs closer to real time. Certainly we had Representative Spohnholz mentioned Anchored Home. 3 years ago, we tried to think different, working with certainly the public sector and the community at large, in addition to people with lived experience and the provider community. We are all impacted negatively by homelessness. Whether your motivation to address this challenge is your children's safety, the safety of your employees as they come in and out of your storefront, or whether you're genuinely concerned about your neighbor, or the combination in the middle somewhere, we all need to solve homelessness, and the solutions tend to be, thank you. Nope. The solutions are the same. The evidence-based work that has ended homelessness in Finland and reduced homelessness drastically in other communities, it really is that continuum, and it's about right-sizing what we do and how we do it for the people in need. And then, of course, there's a lot of questions about how COVID has impacted homelessness. I'll work on wrapping this up and say this is a couple of different data points from partners. Certainly what 211 saw in the changes during the thick of COVID, the first spikes that we saw in mid-2020. Certainly what we're hearing from folks at the state of Alaska doing their census work. But what you can see is that we saw families and individuals reaching out with needs they never expected to have. The number of folks that I've met staying at the Sullivan, staying at some of our other locations, never in their wildest dreams expected to be homeless, but were one job loss away from losing the things that they had saved for. That is what COVID has done to homelessness. And I again, just reiterate that homelessness starts with an economic crisis that results in losing a home. Homelessness is extended by continued economic crisis, and I suspect we are all feeling the economic crisis of what COVID has done to our community, if not, the international community. We're doing quite a bit. Perhaps our PR is not great, but there are many interventions that have rapidly stood up around the work of COVID. This is a smattering. I'm not going to read them to you. I think we've seen some phenomenal successes. Partnership with healthcare. We've seen healthcare come into our shelters and provide care for those individuals that I mentioned earlier who have very complex medical needs. We've seen an incredible success in getting that street outreach that I mentioned to you. The partnership with rental assistance, both with Alaska Housing Finance Corporation, United Way, many of our local provider partners, to make sure that we're preventing homelessness. We have had the capability of truly getting in front of this at a very different scale. Again, this is a smattering of some of the things that are being done around the community to not only address the spike in homelessness related to COVID, but also trying to get ahead of that prevention work, as we know that the economics impacts will continue for a while in Alaska. And then finally, I did want to just mention that it's not all great. We always run into challenges. Currently, we're facing a budget veto at the state level. And I'd just like to take this moment to illustrate what we call the Special Needs Housing Program. It's a SNUG grant. What's important here is this funds supportive housing in our community. For folks that aren't aware, supportive housing is intended to be for people that cannot live independently on their own at this time. And that's probably a loaded way of saying people that are going to require a bit of additional assistance to stabilize. Different folks take a different amount of time, need a different level of service. In Anchorage, people in supportive housing tend to stay in supportive housing for about 3 years. It is, when we say permanent, that's just the name. It is not intended to be for the rest of your life. And a commonly misunderstood idea is people in supportive housing do pay some of their rent. It is not rent-free, almost always. However, we just had our supportive housing for the state of Alaska vetoed. And I'd just like to point out that it's a small amount of money, but the impact is huge. These are the supportive housing programs in Juneau and Fairbanks, certainly in Anchorage. And according to our own OMB at the state level, it is also the most cost-effective solution to chronic homelessness. A lot of frustrated folks come to me and say, how do we get people off of the streets? The answer is housing, and for really complex cases, it is supportive housing. And so you can see right before you data from the state. Supportive housing is not only what's great to get people off of our streets, it also cares for them in the best and most humane way possible, and it is the least expensive intervention, because the alternatives are our emergency rooms, the alternatives are our correctional facilities. Not only are those not treating the underlying needs, those are also not good for our pocketbook collectively as taxpayers and members of our community. So I love to plug this in, don't love the reason for it. I'll also say Governor Dunleavy's office is working with us on this, is very aware that this small amount of money has large consequences, but it feels important to say that this also is at risk right now here in Anchorage, particularly for our supportive housing programs. And we serve the state when it comes to homelessness. If we lose programs in Juneau, in the Mat-Su, in Fairbanks, those individuals will migrate to Anchorage because we have the services. We have individuals sitting in Sullivan Arena today who were flown in or bussed in from other communities. We serve statewide homelessness in Anchorage. We cannot afford to have any cuts to our services for Anchorage, but certainly for the state. And then I think that the last thing I was just going to say was, there are evidence-based and cost-effective solutions, and you're going to hear that from folks that have a deep level of expertise. I always feel a bit sheepish representing folks that have done this work for a very long time. There are solutions. We just need to invest in them, and we need to do it in a right-sized way, and we have to do it in partnership with the community. This is not intended to be something that a small group of people can solve, because it's impacting all of us. And so with that, I'll turn it back over to Lori.
All right, thank you so much, Jasmine, for helping us better understand the needs and the scope of this very large problem that has a lot of layers.